now.
Hello, everyone. Thanks for joining us this wonderful afternoon. Right now, we are going to discuss about Medicare 101, about the basic of Medicare, about the timeline, the cost, and everything that related to Medicare. First of all, let me thanks to Poway Chamber of Commerce that allow me to share about Medicare 101. We know, and I know that this is a very confusing topic for people who are eligible or have been in Medicare. So that's the reason why Medicare Central, that's the organization that I work for, that we often provide this free Medicare 101 seminar because we know about the confusion, about, it's hard to understand basically. So again, my name is Esther Sulistio. I'm a Medicare insurance agent and a local here in Rancho Bernardo. I've been in the business. I've been helping a lot of Medicare beneficiary for the past 8 years. And I've also been presenting Medicare 101 like this, whether it's a virtual or personal in-person training or seminar like this in libraries or senior centers. So that's about me. And let's just go ahead with the Medicare 101. This is the topics that we're going to discuss today, about the components of Medicare Part A, B, and C and D, and also about how to enroll and what is the option and how to avoid the costly mistake or penalty. Now, for your information, you can have your question, you can put it on chat, and then we'd be happy to answer your question. And the video recording of this seminar will be available to Poway Chamber of Commerce website. With that, so let's start with what is Medicare. Medicare is a health insurance program offered by the government. It's only for people who are 65 and older or under 65 but with a certain disability, such as end-stage renal disease or the ALS. And it is administered by CMS, which is Center for Medicare and Medicaid Services. So sometimes, I'm gonna just throw away CMS, say this, CMS rule this, then you know that CMS is the Center for Medicare and Medicaid Services. Most people have to enroll or sign up through Social Security to get their Medicare. Original Medicare has some component, okay? So the first two, which is Part A and Part B, they cover different items or different treatments. However, there is a standardized list of what Medicare covered. It also will allow you access to any doctor, supplier, or provider or hospital across the United States as long as they accept original Medicare. So it's very flexible and in allowing you to choose any doctor. You have to know that there are some costs associated with Medicare, such as Part A and Part B deductible that you have to pay before Medicare starts pay. There's also co-insurance, for example, 20% co-insurance of Part B. So also there are Part A and Part B premiums. So you have to know that there are costs. I mean, it's not completely free. So there are some costs associated with Medicare. Um, so what is Part A? So Part A is the component of Medicare that cover hospital insurance, and then such as inpatient hospital stay, nursing homes, skilled nursing, hospice, and home health services. Basically, everything related to inpatient hospital stay that is covered under Part A. Now, Part B is the component that cover medical insurance, such as your doctor visit, the ambulance, your lab, um, outpatient surgery, physical therapy. So anything that related to doctor visit, physician. Now, Medicare, again, Medicare cover a lot of things, but not all things. For example, they only cover medically necessary service and preventive services. So again, let me repeat that. Medicare only covers medically necessary service and preventive services. Um, so what does Medicare? What are those examples that Medicare does not cover? These are the example list that Medicare does not cover, such as routine dental, so dentures. Those are that is not covered by Medicare. Eye exam, routine eye exam, hearing exam, eyeglasses, okay, and long-term care, um, transportation for your doctor appointment, also prescription that you take at home. Those are not covered by Medicare A and B. So anything that's like cosmetic surgery, acupuncture, again, those are not covered. Okay, so I know a lot of people are senior, they struggle, especially with dental. And unfortunately, if you would like to have dental coverage, you have to have um, a dental insurance for that. Okay. Now, as I mentioned before, prescription drug coverage that you take at home is not covered under Medicare A and B. So how are you going, what are you going to do with that? Then you can have that coverage by joining a prescription drug plan Part B. So this is the part, we call it Part B, is only for prescription drug plan. Prescription drug plan or Part B is offered by many private insurance from big company out there. Every plan has its own benefit, different benefit, copay, tiers, um, formulary means the list of drugs that they cover. So every single plan out there, they have different benefit. So what you need to do before you enroll into one, you must check whether your prescription covered by the plan. You can find out how much the copay, and then make sure that you're okay also with the premium. And then when everything's okay, the plan check, then you can enroll. Okay. Um, Now here is the cost for this year. As you probably know, CMS release every year they release the cost for next year. For example, how much is the Part B premium? How much is the copay? So for this year, the Part B premium or standard monthly premium is 170 and 10 cents per month. Of course, if you earn more, you may pay more. Now they look at your 2 years prior income tax. So for example, right now we are in 2022. They will look at your income tax in 2020. If your income is over a limit of 191,000 for single earner, then you will pay more. And I can certainly give you more information about it, or you can look it up at medicare.gov. Now, the Part B annual deductible is 233. Means deductible means that you have to pay first that amount before Medicare's help to pay for your costs. And then there is another co-insurance, which is 20%. That's for Part B. Now, for Part A, most people, if they work at least 10 years, or if they have enough credit for 40 quarter credit, then they don't pay for the Part A monthly premium. So it's zero copay or zero premium. But if you never work, or if you don't have enough credit, then you can pay the Part A monthly premium up to $499 per month. So again, this is where Medicare kind of relate with your work history. They look at if you have enough credit, again, 40 credit. If not, then you must pay for your Part A premium. But if you have enough, then you pay zero. I have a lot. I also have I got a lot of question about the Social Security check and Medicare. Well, those are they are not related. However, if you have Medicare and if you've been collecting Social Security, um, the Medicare Part B premium will automatically deduct it from your Social Security check. Okay. And then again, this information can be found at medicare.gov or medicare.gov. Let's talk about enrollment. Okay. Now, this is also one thing that people kind of confuse and afraid. Um, if they enroll late and they get penalty. Yes, unfortunately, Medicare does have some penalty that we're going to talk about. So some people get Part A and Part B automatically if you have been collecting Social Security benefit, or you receive Social Security disability benefit for 24 months. So if you've been collecting Social Security benefit, means that you will be automatically enrolled into Medicare, and they will send you the Medicare ID card about 3 months before your birthday month. Okay, but remember, this is not automatic for everyone. So what you can do, this is your, okay, this slide show you your initial enrollment period, your time when you can enroll when you turn 65. So you have 7 months period, begins 3 months before the month you turn 65, and then your birthday month, and then it ends 3 months after you turn 65. So you have 7 month window. Now, during this 7 month, you need to contact Social Security by phone, or you can enroll online at Social Security or ssa.gov. So you can do phone appointment, or you can apply online, or you can also walk into the office. I highly recommend people to sign up online because it's so much easier, faster. You don't have to make appointment maybe in another 2 weeks or in another 3 weeks. So I highly recommend online enrollment. Now, this is the question that make people nervous. Penalty. So what if you're late signing up for Part A? Because most people, they don't pay monthly premium for Part A, then you don't pay for the late penalty as well, because you don't, you have that premium free Part A. However, if people have to buy their Part A, then your monthly premium may go 10%. However, I rarely meet people with a penalty like this. The one that's more common is Part B enrollment penalty. Now, in most cases, if you don't sign up for Medicare Part B when you're first eligible, remember that 7-month window, you will have to pay a late enrollment penalty, and you have to pay this as long as you have Part B. Now, how much your penalty is, they will calculate 10% of your Part B premium for each full 12 months that you should have it, but you didn't sign up. So they look at for your they look at how long you didn't sign up, how long that you have this gap, and then they timed it to multiply by 10%, multiply by the year, and that is the penalty you have to pay as long as you have Part B. And the other thing that's the disadvantage of not signing up, if you are not signing up when you first eligible, you have to wait until next year, which is the time of called general enrollment period from January 1st to March 31st to enroll in Part B, and then your coverage will only start July 1st. So better pay attention when you turn 65, and then find someone to help you, find an agent, for example, yeah, like me, to ask question and then find out whether you need to enroll or not. Okay. The other late enrollment penalty is for Part B. So again, as we remember, Part D is for drug, for medication. The same thing happened if you did not enroll during your initial enrollment time, or if during your Medicare coverage you have a gap of 63 days or more, you may have this penalty as well. And then the way they calculate it is you have to multiply 1% to the $33. So this is the national premium that's standard by CMS. So 1% times 33 times the uncovered months, the months that you have that gap. And then again, you also have to pay this as long as you have late enrollment penalty. I mean, you have Part B. So I unfortunately, sometimes I met people with penalty for Part B, sometimes they have penalty for Part D. I met this lady who didn't have it since 2006 for the longest time, and she has to pay like $67, $65 a month on top of her Part D premium. So it's good to find out what you need to do. Yeah, make sure that you understand Medicare when you turn 65, because this is your responsibility to know. Um, Now, there is some situation that allow you to delay in enrolling in Part B or Part D. Um, there are some situations, for example, the one on the list, shown on the list here. So the first one is very common, which is someone who has employer insurance coverage or a retiree plan. So these are the most common situation when people can delay in enrolling their Part B or Part D because they are still working. Um, they still prefer to keep their current insurance from the employer. So that allow them to to delay enrollment without penalty. Um, if you have COBRA, or if someone has COBRA, this is you must pay careful attention, because COBRA is not considered a creditable coverage. So if you turn 65 and you have COBRA, you must enroll in Medicare to avoid the penalty. Someone has TRICARE, I believe that they have to enroll into A and B as a primary. So Medicare will be the primary and TRICARE will be the secondary. Okay. So let's take a look at this special situation here. Again, this is the one that's most common. Um, if you work, if you been covered by your employer insurance, and then yeah, you're still actively working, and the company has is considered a large company, over 20 full-time employee. So you can delay. You can delay in enrolling in Part B or D. Um, Although most people I know that they enroll just in A because it's premium free. Now let's say you delay that Medicare enrollment, but then for some reason you would like to sign up to switch to Medicare from your employer. Maybe your employer insurance has gone up a lot, or the coverage become less and less desirable. So you can enroll in Medicare anytime that you or your spouse are working and you're covered by a group health plan. So anytime you still work, or 2 months after your employment ends or your group health plans ends. So again, you have what we call SCP, special enrollment period. You can switch to Medicare as long as you still during the time you're still working, or 2 months after your employment ends or your coverage ends. So that's the time um, you have to enroll. I just want to go back to this slide because I know a lot of people very confused with this. If this happened to you, I would suggest you to feel free to contact me. This is actually a good time if you're working and you turn 65, just to talk, to discuss what would be the best option, whether you want to stay in in your insurance from the company, or whether it's a good idea to switch to Medicare. So this is something that we can compare the cost and also the benefit, because some company give a very good benefit, and then it just makes sense to stay in that employer insurance. But some company, they don't provide very good benefit, and you probably pay more if you stay in that insurance. Then it's a good idea to switch to Medicare. So that's why at this point, if you're still working, if you and you turn 65, it's a good idea just to talk, to discuss this with an agent or with me, and then just to get an idea. So which one would be a good option? Okay. All right. So let's talk about the Medicare option. Now, the reason why we need to get into Medicare plan, just because as we discussed earlier, that there are some costs associated with Medicare. There's this Medicare Part A, B deductible, and also the co-insurance. So it can get a lot if you, for example, you end up in a big treatment with big costs, and then maybe you have a couple $100,000, and then if you have 20% of that Part B, can be big. So that's why I recommend people to get additional coverage, just to minimize your costs and give you some safety um, limit or safety net, minimize your costs and give you some peace of mind. Now, there are two steps to get additional coverage. First of all, of course, you must enroll. Yeah, you must be enrolled in Part A and Part B. Now, once you enroll, you will have this Medicare card. It will show you what's your name, your Medicare number, what is the Part A, Part B coverage start date. Um, when you have this card, means you already have A and B. Okay. Now that's the first step. The second step is this is where you can analyze or you can research your Medicare options. And to give you to have additional coverage, there are two options. So the first one is by having Medicare Supplement insurance, or we call also Medigap, plus Medicare Part B plan. So you have Medicare Supplement insurance plus Medicare Part D for your prescription drug. Now, these two insurance are sold by private health insurance company. Medicare Supplement will cover some or most of the costs that not covered by Part A and Part B. So it will help to pay for your Part A premium, for your Part B. Sorry. Um, it'll help to pay for your Part A deductible and Part B deductible, and also it also pay for your 20% Part B co-insurance. So some plan it pay very good. They provide very good coverage. Some plans kind of more basic, but if you choose a plan with a very good coverage, then you will pay more in the premium, right? So of course you pay. I mean, you get what you pay basically. So the plan with the highest coverage has the highest premium. Now the same with Part D. Part D only cover for your prescription drug. It does come with extra premium. The premium will be different depend on the coverage that you want. Okay. Now the other option, which is known as Medicare Advantage plan, or also known as Part C. So now we have A, B, C, and D. Part C is a plan that combines everything, Part A, Part B, hospital coverage. It also provide additional benefits like vision, hearing, or dental. It's also include prescription drug plan, and it's all combined in one single plan, one single card. Okay, so you have two options: either Medicare Supplement with Part B or Part C or Medicare Advantage plan. So let's compare between these two. So see, I mean, if you know what are this, then you can decide which one you prefer, which one is suitable for your needs, your coverage need, or your budget. So Medicare Advantage is it's a network-based plan. So um, it is most likely in the type of HMO or a PPO plan. Yeah, we have in San Diego, we have HMO and PPO plan. Um, we have a lot of $0 monthly premium for a lot of plan in San Diego. People rarely pay any premium for this. Okay, so this is a very good plan for people who have strict budget. But remember, people or client or customer has to pay, continue to pay their Part B premium. So they must pay their Part B premium monthly. So again, Medicare Advantage is a network-based plan. It includes a lot of benefit, value-added benefit like hearing, vision, dental, or fitness membership. I mean, free fitness membership, transportation to your doctor, or routine chiro or routine acupuncture. So this plan is really good, even though it's $0 plan premium, but it's still relatively very good compared to individual health insurance plan, perhaps. Um, Prescription drug plan, prescription coverage is included. Maximum out of pocket cannot exceed 7,550. In fact, a lot of plans have only maximum out of pocket of 2,900 or 3,400. It guarantee issue at all time means that there is no underwriting when you register, when you sign up during the appropriate time. They will approve you. They will give you, you know, they will approve you right away, basically. All right, and the other thing is Medicare supplement. So the other option is Medicare supplement. This is a type of insurance to pay for your cost that's not picked up by Medicare. There is extra premium for this, $140 to $300, depend on the plan that you choose. Now, what's good about Medicare supplement is that there is no network. Means that it's accepted anywhere original Medicare is accepted. So it travel with you. Um, I see a lot of people. I have actually client who, stay 6 months in San Diego, 6 months in Florida. So Medicare supplement would be a perfect plan for this type of client. Also, some people really um, like the flexibility, the freedom to choose doctor. So maybe they have primary care doctor in scripts, specialist in UCSD, or cancer doctor in LA. Um, that would be perfect with Medicare supplement because it's allow you to choose any doctor, no network limit, and yeah. Also, the other thing is the coverage is pretty good. Actually, it's very good. The most common type is F and G. This is the one that cover most of the costs. But there's no value added benefit like the hearing, vision, and then also there is no prescription drug plan included. So you have to buy another standalone prescription drug plan. So it's also another separate premium. And the other thing is that this is an insurance, so it's only accepted guarantee issue during the first 6 months you have your Part B. Outside that 6 month window, outside that open enrollment, there's always this underwriting process that you have to go. You have to be approved in order for you to get Medicare supplement. All right. So the next thing that we discuss is about the timeline. So let's say that, okay, I would like to choose Medicare Advantage plan, or oh, I would like to choose Medicare supplement. Now you need to know when you can enroll, correct? So for Medicare Advantage plan and Part B plan, the initial enrollment time coincides with Part A and Part B enrollment time. So you also have 7 month window that start 3 months before the month you turn 65, the month you turn 65, and 3 months after that. So it's also the same 7 month window. Um, Now the Medigap is a little different. Again, I mentioned that this is actually also an insurance, so there's also underwriting process that involved in it. So, when would be the best time to enroll in Medigap when you really know that you want to get this plan? So actually the best time to enroll is the 6 month period that starts the first day of the month you are 65 and you enroll in Part B. So you have 6 months when you start your Part B to enroll into Medigap plan with guarantee acceptance. The 6 month window we call is open enrollment. Outside this open enrollment, the insurance company are allowed to use the medical underwriting and to decide whether they accept you or deny your application. So there's no guarantee that you will be accepted. Okay. All right. And then with that, I just would like to throw some suggestion. Um, People probably confused on which plan, from this company or that company, or should I choose Medicare Advantage plan, or should I choose Medicare Supplement? Which one would be a good one? So these are some consideration that you need to think about. The first one's gonna be, of course, which one has a good benefit, which one that's provide what I need. Okay, so you need to know, which plan, whether you want the Medicare supplement with very, very good coverage, or if you're healthy, then you can, just pay as you go, then you can go with Medicare Advantage plan. And the other thing is the cost, the monthly cost. For example, hey, it's hard for me to pay the extra monthly premium for Medicare supplement and the party plan. If that's the case, then we might as well just go with Medicare Advantage plan. Like I said, we have a lot of $0 plan premium here in San Diego. The other thing that's quite important is the network of providers, because um, generally one doctor or one medical group only accept a few plan. They don't accept all the plan available in San Diego County. So you need to know, for example, this group, what Medicare Advantage plan that they accept. Of course, if you go with Medicare supplement, then the Medicare supplement will give you the freedom to choose doctor. So those are the things that you need to consider. Also, travel, prescription coverage, those kind of things that you need to consider. I realize that this is not for everyone. It's not easy for most people. So I would suggest you know someone, an agent, working with a knowledgeable agent will save you all this time and hassle. Um, because we have been in, we as agent, we have a lot of training that we have to attend. We have to know the benefit of the plan. We have to understand what's the network. So working with a local knowledgeable agent is very, very, very beneficial for you. Okay, so with that being said, I would consider, if you would like to work with me, feel free to contact me. Uh, this is my contact information, my phone, my website. And with that, I'll give back to David. Thank you, David. David,